welcome back, guys, to another episode of the Fill Me In podcast. I am Injector Jon.
And I'm Aesthetic Nurse Nicole.
And we're about to dive deep into the world of aesthetics and talk about pregnancy-safe skincare. Okay,
Yes.
This is very common right now. Everybody and their mother's getting pregnant, including Nicole.
Including me. This is like a little part 2 of our last episode with Dr. Simons. So we're going to kind of dive into safe ingredients and products that you can purchase at pretty much any med spa, but especially Jon and I's.
Mm-hmm. Correct.
So we can help you pregnant folks out there build a regimen like me and keep your skin as healthy as you can.
Because that's what happens. I mean, obviously, when you're pregnant, you can't get Botox, you can't get fillers, you can't get your lasers or microneedling like you normally do.
Mm-hmm.
So you want to, protect your largest organ, which is your skin, during pregnancy, and do as much as you can. So that way, once you pop that baby out and you stop breastfeeding, you can start doing your injectables again.
Yes, exactly. So starting with cleansers, really our safest bet is to, one, steer away from anything. And if you listen to our last episode, you already know, but retinols, high amounts of salicylic, hydroquinone, even anything that's like very irritating or can actually cross through that blood and end up in the placenta. So very gentle ingredients. So my first item on the list is the Zio Gentle Cleanser. I love that cleanser. It's very like soft. It foams really well, gets all the makeup off. But it does have fragrance.
Okay.
So if you're not a fragrance girly, then something a little different might be better. I know Skin Better.
They're cleansing gel.
Yeah,
they're cleansing.
yeah.
I mean, it's as simple as it gets. It's just a gel. It's something that if you have a full face of makeup on, you can do a double cleanse with it. Or you can start with the cleansing gel, and then you can do the refining foaming cleanser, which is right after that. That's pregnancy safe as well.
Yep.
It's just a chemical exfoliant, very gentle. The other option, if you want something a little more exfoliating, is the AHA BHA cleanser, the AHA Baha cleanser with Skin Medica. That has jojoba beads in it, but it's very, very gentle.
Yes.
It's slightly fragranted, but nothing crazy.
Yeah.
But it has a little glycolic in there, but it's still pregnancy safe.
Yes. And that's great if you're someone that needs to get that dull skin off. Some of us just get like flaky and you need that exfoliation. Exactly. Yep. So that's a really good one for that. I actually love the AHA Baha cleanser.
I love it too. And I think I started doing it more actually this winter. I just felt sometimes I just felt like I was getting like a buildup of dead skin cells, and it gets rid of all of it. Yeah. I know that Zio has their exfoliating polish as well. Is that pregnancy safe, Nicole?
It is, but it does technically contain salicylic at very low levels, and you're washing it off. So technically it is, but I would always ask your OB. And if you're not comfortable using salicylics, then don't use that one.
Then don't use it.
Yeah. But
you can switch to AHA BHA with Skin Medica. Perfect.
Exactly. AHA BHA is more of like glycolic, lactic. It doesn't contain as intense ingredients. So gentle cleanser from Zio, cleansing gel from Skin Better, or refining
foaming cleanser from Skin Better.
Foaming cleanser, or your AHA Baha from Skin Medica. All really great options, and all pregnancy safe options.
Yeah. And a lot of people wonder if you can use vitamin C when you're pregnant. You can.
Yep, absolutely.
And I know for myself, I use the Alto Advanced Defense and Repair Serum from Skin Better. I love it. It protects the skin intrinsically and extrinsically. So extrinsic meaning environment. So it neutralizes free radicals in the environment, but also intrinsically prevents oxidative stress within the cell. So it's literally just not letting your skin age, which is great.
Yes, we love that. Yeah.
What do you use?
So that was my serum options. So actually Alto is one of the ones, but I also use Zio vitamin C. So Zio vitamin C, it's a 15%, and it's just straight vitamin C. It does have a little bit of a weird smell to it, but you get used to it. I think they all do.
I love it. I was just going to say, like, if I'm not using my Alto with Skin Better, I'm using the CE Ferulic with SkinCeuticals. Oh, love me a CE Ferulic. It smells like hot dogs, but I love it.
Yeah. That's another great option. That's so funny. And they all have different consistencies. So I would say Alto, if you've ever used like Daily Power Defense from Zio, it has more of that like moisturizer kind of feel, where the one from Zio just feels like, it feels thick.
Right.
And then
And
the
then
CE ferulic is like,
it's more water based. It's
yeah,
in a
yeah.
dropper, and it just like I have it on right now, and
Hmm.
I swear, well, there's two products that I think are really giving me the glow that I'm getting
Yeah.
right now. But the next one is peptides. We want to talk about
Hmm.
peptides. Peptides are all the rage right now,
Yep.
topically and also ingesting them.
Yeah.
I had to think for a minute.
In some form, yeah.
Right. But SkinCeuticals has their new product called PTOX, which is a peptide serum.
Okay.
It also helps to slow down a little bit of muscle movement as well that are causing static lines and wrinkles.
Interesting.
So it's really good if you have, obviously during pregnancy, if you're very expressive
Hmm.
and you're developing some static lines, this PTOX is really good at smoothing them and pumping up the skin.
Wait, okay,
Which is great.
seriously? Add to
Mhm.
cart. You
I
have
will
that?
add to cart. I
You
do.
have that?
Yeah.
Mail
I'll
it to
send
me.
it. I'll mail it to you. I'm sending it, literally overnighting it for you.
Mail it to me right now.
Yes. Yes.
So yeah, so the another really great serum option too, I guess for me, I don't consider it a serum. I consider it like the end of my skincare routine, but like a growth factor serum.
Mhm.
So Zeo makes a great one that's actually extremely moisturizing. I
Yep.
really enjoy that one. TNS is a great option
Holy grail.
from
Mhm.
Skin Medica. That's a great option. They all promote like skin rejuvenation. It helps with skin tone. It helps kind of like your cells turn over quicker.
Mhm.
It's helping your growth factors.
Mhm.
So again, and during pregnancy, when we can't use all these
Yeah.
active ingredients, we want to
Yeah.
use things that are at least helping boost our own cells.
Yeah,
So
what I tell patients is like if you're not getting skin booster, which is an injectable skin booster we can do in the office, then you're going to get TNS.
Mhm.
It's your topical TNS.
Yep. I love that. I love that.
Mhm.
We skipped it over it, but toners. Do you use a toner?
I don't.
Yeah.
But my esthetician swears by them,
Mhm.
and she puts a lot of our patients on them.
Yeah.
Do you
I
use a toner?
I guess it could be considered a toner. I did cut it out when I became pregnant because in the last episode, if you listen to the last episode, I've
Mhm.
actually become dry and like irritated, which is funny because I've never used moisturizer in my life. I'm a Zeo girly through and through, and Daily Power Defense was the most moisturizer I've ever used. So
Right.
to be like this for me is weird, but before pregnancy, I used the complexion renewal pads from Zeo. So they
Okay.
have they're glycolic, salicylic. There's a couple different things in there, but you use the whole pad till it's dry over the whole
Yep.
face, and it's almost similar to something like Alpha Ret from Skin Better.
The Alpharet exfoliating peel
Mhm.
pads. Yeah, they have lactic acid, glycolic, and salicylic.
Yeah.
Yep.
And although
And
the
retinoic
Alpha Ret,
acid.
yeah, the Alpha Ret is not pregnancy safe. The complexion renewal pads are. So if you can tolerate a little bit more of like, I guess exfoliation and a little bit more of an intense ingredient
Right.
while you're pregnant, those are technically safe.
Mhm.
And
That's great.
they help reduce the oil. They help, with
Mhm.
the exfoliation. And if you're feeling dull, that's what you need is exfoliation. So
100%.
those can be a
And
good add-in.
you can always get a facial and get
Mhm.
hydrofacial or microdermabrasion if you're feeling like your skin's looking dull.
Yeah, that's another thing is those are
Mhm.
pregnancy safe. You can
They
get a
are.
hydrofacial, you can get a diamond glow, even just a customized
Just make
facial.
sure you tell your esthetician you're
Mhm.
pregnant. That's all.
Yes.
And then she'll know to use pregnancy safe products.
Right, right.
The next thing are pigment inhibitors.
Mhm.
I like to use Even Tone Correcting Serum,
Mhm.
which is through Skin Better. So melasma or chlasma, like we talked about in the last
Mhm.
episode.
I feel
is
like an
a huge-
idiot. I didn't know they were
Why?
I didn't know they were the same thing.
Well, do you know why? Because I prescribe hydroquinone to some of my patients, and I have to put a diagnosis in, and it's
And that's
chlasma.
okay.
Yeah.
Yeah.
So that's the only way I try to do
Literally,
that.
I'm like researching. I'm like, what the hell is chlasma? I'm gonna ask him. Stupid.
But no, the majority of pregnant patients that I have, I recommend Even Tone. You don't have to do it, but if
Mhm.
you're someone who knows that you already struggle with melasma or hyperpigmentation, it's great to start it. It's basically Xanax for your melanocytes. So it's basically going to inhibit the formation of pigment.
It calms those melanocytes down. I
It
love
does,
that.
yeah.
Xanax or the pigment cells. That's so funny. I personally use right now Bright Alive from Zeo.
Right. Oh,
It's
I heard
all
great things about that.
Yeah, it's all plant derived. It smells delicious.
Mhm.
And I love it. And it also gives me a little hydration, which is nice because I need that right now.
Right. That's awesome.
Hey guys, just popping in to remind you to like, subscribe, and hit the bell for notifications. Also, don't forget to follow us on Instagram, Injector Jon and Aesthetic Nurse Nicole. Thank you so much for watching. And if you have any questions, leave it in the comment section.
The other one that's pregnancy safe is resveratrol.
Oh yes, yeah, for rosacea and things like that. Yep.
Yeah.
And that was another thing we talked about in the past episode was how pregnancy can basically make your rosacea worse or
Sure.
flare. So they suggest you try to reduce as many triggers as possible, like spicy foods and extreme temperatures, which we're not able to do right now, but you know, things that might make it worse. But the pregnancy in general is it can flare the rosacea. So things like Rosatrol and things like that from Zeo can be very beneficial for people that are dealing with that.
I love that.
Yep.
The next one, I mean, obviously, I mean, this time of year we're also dry, but I feel like also hydration so important during pregnancy. Your skin changes, like as you know, Nicole. So you've been using a lot of hyaluronic acid and doing like face masks to promote that.
Yes. I love Hydridity makes that restorative.
Oh, it's amazing. It's so good.
It's a sheet mask.
Yeah.
And I do probably 2 or 3 a week. I just can't get enough. And honestly, for like a day or two after, I just have that extra plump, like the little lines that I see in my forehead. I don't see them as much when I do that. But they also make it in bottle form. So like not sheet mask form, the restorative HA, which I also, it's so funny because Brittany was like, I want to bring on Hydrinity. And I'm like, we already have so many HAs. Like we have so many hyaluronic acid products. We don't need another one. And I was like, fine, I folded, I let her do it. And now it's like my favorite HA. I've been using it all the time.
And they have their highest inactive spray, which is hypochlorous acid, which that's pregnancy safe.
Yes. Yep. And that's been really good for bacteria for me.
Huge for acne. It's actually good for perioral dermatitis, perinasal dermatitis as well.
Yep. So when you have to cut out your active ingredients, and for someone who's acne prone like me, that's major because I break out. So my only option is pregnancy safe things like hyacinth, the hypochlorous acid that I literally spray morning and night on my face.
God, I bathe in it. Oh my God.
It's so refreshing, dude.
It's so refreshing. If you're a little anxious, a little spritz midday, it's just, it's like I always say, little spritz, new day, new spritz.
Exactly. No, I love that stuff too, but definitely moisturizing. Yeah. And like I said, this is a new world for me. Moisturizers is a new world for me.
Now, for those people like myself that, I mean, I'm very glowy right now, but I also get very oily towards the end of the day. So sometimes if I overhydrate, I can actually cause more breakouts. So if you're not like Nicole and you're actually more oily, don't worry. You don't have to moisturize as much because you might congest your pores and you might, break out more. But you
want a thinner moisturizer than something like I'm doing. Great options for that. Also pregnancy safe would be the Zeo. Well, that and Zeo Daily Power Defense.
Oh, okay.
So that one's more of like, it helps protect against your free radicals and things of that nature, but it also is moisturizing and supports the skin, and it's super lightweight. So I really, really like that one. But
I love that.
Trio.
What about our neck, Nicole?
The neck is the toughest thing to treat, and it's also the one thing that we all neglect.
Yeah. We do.
I don't care if you tell me you're washing your face, your neck, and your chest and doing your skincare on all of it. You're not. You're lying.
You are, because I don't. And I'm not going to lie. Like, I don't, when I wash my face, go down to my neck. Then it drips down my shirt. Then I'm cold. It's a whole thing.
Exactly. No, but we should always be putting cream on our neck, which I have started doing now that I'm pregnant. I will say I was one of those, like, I would do it every now and then when I remembered, but I wouldn't be like on top of it.
Now, after the shower, I'm very good about it.
Of course. Yeah. After a full, if you shower before you go to bed, you are like, I am oiled up on everything. But if I'm showering in the morning, I'm like, I gotta go. I gotta get to work.
Right.
But a great option for that is the Neck Correct cream
by
from
Skin Medica.
And also pregnancy safe.
Yeah.
Everything we're discussing today is pregnancy safe unless we mention otherwise. But that one is honest. And I've honestly seen major changes in the horizontal lines in my neck when using that consistently.
And then obviously, if you're a Skin Better queen, you can use their Techno neck cream as well. Okay.
Also pregnancy safe.
We love. And it has niacinamide in it, which helps to vasodilate your little capillaries and promote blood flow to the surface, increases oxygen to the surface. So it's anti-aging as well.
Yeah.
Yeah.
Other moisturizers too. We talked about the Daily Power Defense. You mentioned Trio. Go into Trio and Trio Luxe.
I love Trio. I could bathe in a couple things, and it's TNS and Trio and some C for like maybe. But basically Trio, it's a rebalancing moisture treatment. So when you put it on your skin, it's good for combination skin. So whether you're dry or oily. So when it goes on the skin, it actually knows what it needs. If it's too dry, it makes you more moisturized. If you're more oily, it doesn't secrete more. Is it sebum or more? Not sebum. More.
Well, oil, right? You're secreting more oil.
Yes.
Yeah.
Yes.
Sebum. Yeah.
It basically says, no. We don't have to secrete as much of that to hydrate the skin. So it's a rebalancing. It's the lightweight, heavy duty moisturizer is what I say. And then Trio Luxe, I mean, she's rich. She's
thick.
She's thick. So if you are oily, goodbye. You don't need that. But if you're very dry, like this time of year, oh my God, especially nighttime when you need the moisture the most, Trio Luxe is where it's at.
I will say Trio Luxe has been my go-to
saving grace.
Nighttime one. Yeah. During the day, it's impossible. I can't put makeup over it. It's just that thick. It's like, it doesn't sit well with much. So it's more of a nighttime cream, but I love that one.
Yeah.
And I use Trio in the morning. So like I do Trio in the morning, Trio Luxe at night.
Yeah.
So they counter, they're good. One's a little thinner, one's a little thicker, and I just use them as necessary.
I love it. Use them as needed.
Now the new HA5 from Skin Medica, we're also loving.
Oh, the hydrocollagen. Oh, so good. You know,
so good.
They're coming out with a new cleanser too. Did you hear about it?
Really? I didn't hear about this. No. Ooh.
Yeah, it's top secret.
Ooh, I can't wait to hear about it.
Yeah.
John always gets the insider.
Oh my God. Because I asked too many questions.
Yeah. And then you always are like, don't say anything.
I know. Well, I go, I'm always like, sweetie, tell me what's on the pipeline. What's on the pipeline?
What's coming?
Just tell me. Give me a hint.
They love sharing it. They want the buzz out.
They want
about
the hype,
it.
the buzz to say something's
exactly.
coming. But I feel like the hype right now, ever since the refining foaming cleanser, we have like these like foaming cleansers coming out. So we shall see.
Yeah. Yep. Ooh, exciting.
Yeah.
Was that a little hint?
Huh? No, it's not at all.
I'm dead. Well, we talked about the neck. What about the eyes?
Oh God, the eyes.
This is like, I feel like our dreaded question.
Can I be honest with you right now? I'm all about an eye cream. If someone wants an eye cream, I will pick an eye cream that's meant for that person and give it to them. But I personally don't use eye creams. I put my TNS, like when I apply my TNS,
everywhere.
I even put it upper and lower eyelid. And then Trio, upper and lower eyelid. I will say like C for like any like vitamin C, my eyes are sensitive to it. I think it's just, I don't know if you are too. I feel like because
I'm
we're more
so
fair.
sensitive. Yeah.
Me too. I think it's we have lighter eyes. We're fair skin. So our eyes are a little bit more sensitive. And anytime I apply my C for like, or vitamin C, I avoid my eye area. So I just have to be careful when I'm doing my Trio. I love to put it around my eyes. Yeah. But sometimes I can,
I do the same thing. I put every like ingredient, every layer that goes goes around my eyes. Obviously not in my eyeball, but it goes in the area. But I have been loving the Interfuse from Skin Better.
It's so good. And honestly, their IMAX is really good too, which is, it's a retinoic acid eye cream, safe for the delicate eye skin.
Yeah. The Interfuse is safe for me to be using right now. IMAX would not be safe because of the retinoic acid or whatever's in it. Yeah.
Yes.
So I can't use IMAX or any of you pregnant patients listening, but we can use Interfuse. And Interfuse is meant to help basically plump the lines.
Yeah, it's like peptides and antioxidants, right?
Yeah, yep. And I use it around my eyes, my laugh lines, and my forehead lines.
Oh, I love that.
Yeah, and that's like my last step of the whole routine.
I know SkinCeuticals has their restorative eye.
Okay,
that's actually very good. I've used it.
Yeah.
It's good. It's kind of a brightening eye cream, which I love. But yeah.
There's not a ton of really impressive eye creams out there.
Not.
Yeah.
It's kind of like neck creams, to be honest with you. There's no neck cream that's like, whoa, you know, it's like Botox in a bottle. No, nothing is Botox in a bottle. Yeah. Let's be real.
And you unfortunately have to give everything at least 8 weeks to even see a difference.
You do. Consistency too.
No one really gives it that long, you know, but
I did it for a week. I didn't see anything. Well, keep going.
Right.
You know,
8 to 12 weeks. Yeah.
Yep.
But it's never going to be a surgical or like
No.
any kind of result like that, because it's just cream at the end of the day.
Especially like if you're in your 50s and 60s or 70s and you're just starting an eye cream, you might notice a little bit of a difference. It's not going to be a lot.
Right.
You know, it's just at that point going to prevent from that point on.
Yeah, exactly. On top of that, your sunscreens are very important. So I prefer to use Color Science, but they make a non-pigmented, but it's a pigmented sunscreen. So I use it as my makeup. And that's like my last step. It's also skincare. It's got niacinamides, which are really beneficial to the skin. It's
also hydrating.
Yes, hydrating. So it's very hydrating. I actually have to powder it sometimes.
Oh my gosh, yeah.
Because I'm oily, which is just so weird. I'm dry and oily. I'm all over the place, but by the end of the day, if I only do Color Science without powdering it, I definitely do a little like an oil slick.
Right.
But that's my favorite SPF. But then I also do like what is it, Ultra Sheer or something
from Skin Medica? Yeah,
yeah.
It's
because
lighter.
Exactly. I don't like a thick sunscreen. Like I hate to feel like I'm like rubbing.
Ultra Sheer. Well, there's Skin Better Sheer. Which is like, it's honestly, I don't use it unless I'm going to the beach. And then they have their Tone Smart, which
the Tone Smart's nice too.
I love Tone Smart.
Yeah.
That's honestly like a foundation for your skin. It like basically tones to your skin.
Yep.
Like tone.
Yeah. So those are the Skin Better options. There's so many sunscreen options.
Were you meaning like a moisturizer, the Ultra Sheer Moisturizer by Skin Medica, you think? Was that what you were thinking?
But they also have a sunscreen.
Yeah, they do. It's their shield.
What is it called?
There's tinted and untinted. Essential Defense.
Yes.
Yeah.
I've used both the tinted and untinted of that.
I like them both.
Yeah, I like it because it's not like super thick.
No.
Yeah.
Yeah, and it blends really well. There's some, I don't know, like some people love the Elastin Hydra Tint.
Yeah, I've never used it.
I love it.
Yeah.
I love it. I will say sometimes it's a little too orangey for me. I love Tone Smart. Tone Smart is my favorite, I think. She's a little thick when you're rubbing it together, but it goes on really nice.
Yeah.
But yeah.
Yeah, and the Color Science is nice because they make a couple different colors. I think Tone Smart only has one color, right? Because it's like supposed to go to your tone. So for us really pale people, sometimes it could be a little difficult to match. But Color Science has like no color, and then they have just Glow, which is like a little bit of color, but not really. And then, your fair, your medium, your dark, your deep. And they also have bronze drops, which I love mixing into my daily power defense.
And everyone looks a little bit better with a little bronze,
Exactly.
The skin looks healthier. Yeah.
Yeah. And so I just take a couple drops of the bronze drops, put them in my daily power defense and put that on. And it just gives me like a little glow, covers a little bit of redness. So I think
the big thing is people, I think, feel like, especially if they're on a good routine, seeing their injector, seeing their esthetician, and then they get pregnant. I see it all the time. I feel like they're like defeated. They're like, all this work now in 9 months, like, oh God. Then they come back and then they don't feel confident about themselves. And I'm huge on, guys, like, we can get you on a pregnancy safe routine. Do routine facials. If you can't afford them every month, do them every other month, or every 3 months. You will preserve your skin and you will get through it.
Yeah.
And that Botox syringe will be waiting for you.
Exactly. And I do think that a part of it is kind of like mental health too.
Huge.
Giving you that hour of just relaxation, but also focusing on you and your skin.
Yeah.
It's like a twofer, you can't go wrong.
So true. Yeah. And we always talk about protecting what you inject anyway. I always feel like too, a lot of the women that are my patients that we, put on a pregnancy routine, they continue it religiously afterwards. And they're like, I even noticed better results now because I feel like being pregnant, it forced me to take care of my skin.
Right. It's your only option. Yeah.
Right. And now I'm getting my, my skin or my injectable treatments again. And I'm like, wow, I noticed such a huge difference.
Because that's something we try to drive home so often, is making sure that you're investing what, protect what you inject, as you always say.
The skin investment. Yeah.
Yeah. Your skin investment. Like, if you just do Botox and fillers and you never focus on your skincare, you're never going to get to that next level.
Yeah. It's like the patient that, let's just say they could be 35, one of these patients, but most of them are like in their late 40s, 50s, 60s.
Mm-hmm.
They've had years of sun damage. They used,
Mm-hmm.
you know, baby oil or iodine. They didn't use sunscreen. It's those typical patients
Oh,
that
yes.
they basically, you think they live in Florida and they just sit
Yeah.
out in the sun all the time, right? And they come in and they're like, I have lines all over my face. You know, I want them gone. And you're like, well,
Doesn't work like that.
God.
Yeah.
It's so hard to get
Yeah.
rid of those, you know, those lines. So, and that's why we say like protect your skin, because
Mhm.
if you come in with those and with those lines, like, right, if you're in your 50s and, you know, we're doing fillers, right? And we're all, you know, people come in and they're thinking, okay, I'm going to get Botox, I'm going to get fillers, I'm going to feel better, I'm going to feel more confident when I look in the mirror. Well, yeah, they'll look maybe a little bit more lifted and contoured, but they'll keep seeing their skin.
Yeah.
And that will skew
Exactly.
what we did. So
Mhm.
I always say, like, you know, if you're doing injectables and you're over, you know, period, if you're doing injectables, you should be on at least a retinol and a vitamin C,
Yes.
because you got to do your homework at home,
Mhm.
because your injectables will only look so good as your skin does.
Right. Exactly. And they'll only last as good as your skin can hold them. Yep.
Right.
Yep.
Exactly. And side sleeping's another thing.
Mm-hmm. Oh, the side sleeping.
The side sleeping, right? It's a whole thing.
Yeah.
Mhm.
I always suggest a Sleep and Glow pillow to all of my patients because it has an indent that you can put your head into. So yeah, it still may push at the top and the bottom, but it's not pushing or folding the whole face or the mid face or under the eye where we see a lot of those lines start to form. So I always suggest like invest in a good pillow, you know?
Well, think about it. Like people that sleep like this,
Like, look at all those lines.
Look at all those lines.
Yep.
Like, and then they wonder why, oh, my 11 line's still there. Well,
it's
look what
not,
it's doing.
yeah, and it's not from your Botox. Like Botox can't fix that. That's a sleep line, right?
Mm-hmm.
Yeah,
exactly.
Yeah, I usually tell patients if you see a line that's more vertical and it's
or diagonal or something.
Yeah, and it's long and it's not coming with any, or it may be there with muscle contraction, but when you stop, you're still seeing it. It's most likely a sleep line. So we have to start addressing how you're sleeping. And we know it's hard. We know not everyone sleeps like a vampire like me. I literally sleep like I'm in a coffin.
Yeah. Like we're a corpse. Yeah.
Yeah. That's been the hardest thing for me is I've had to become a side sleeper now being pregnant. So it's like, it's just funny. Everyone's different.
I know.
But
and we honestly sleep for the majority of our life.
Yeah.
You know what I mean? Sleep is so important.
So important. So important.
Yeah.
With all those, so pregnancy safe regimen altogether should really consist of your cleanser, your toner, your serums and peptides, maybe a growth factor here and there, and a moisturizer. If you want to throw in an eye cream, I think Interfuse Lines is a great way to do an eye cream, but also be able to focus on other areas like lines.
Right.
And then your sunscreen, of course, especially for those patients that have melasma, because you want to protect it as much as you can and reduce how much UV exposure you might be getting. And then lastly, which I'm really good with, is the LED therapy. So like red light therapy, blue light therapy on the face and neck, even the chest, because it is safe. It's not going to cause any harm. You're going to boost your collagen while you can't do anything else. It's going to help penetrate your ingredients even further. You could do it before or after your skincare. I honestly do whatever works best that day for me.
It's good for pigment.
It's good for pigment. Right. Exactly. So it's going to help as much as it can in the meantime while you can't do anything else.
Right.
So that's a major component of my routine as well. Just to make sure that I'm doing everything in my power.
And you can scare your spouse as well.
Yeah. Yes, that's the funnest part.
Yes.
You walk out in your robot mask, lighting up the whole room, and they're like, what on earth is that?
I love it. I always feel so extra when I wear it. And I just, anything to make me feel like a housewife just makes me happy. So funny.
Oh my God. No, it is. It is a very interesting look.
Oh yeah. My God. Did we miss anything, Nicole? Or
no,
what do you think?
I think that's everything.
I know. And obviously, like, you know, our listeners listening, if we're missing something, shoot us a DM.
Right.
You know, if you guys follow us on Instagram and you see this reel that comes out about this, like, just comment on it. We want your feedback as well.
Yeah.
We love a good educational discussion.
Yeah.
No negatives, all positives. LOL.
Don't leave us a hate comment. No.
No. But no, there's always room for learning here.
Yes.
And we love to hear other people's perspectives on this as well.
Yep. I was dying earlier. Do you see that guy? In a couple episodes before this, Jon is talking about how he treated someone's masseters, and instead of saying millimeters, he said centimeters. Because we're tired people. This is like our fourth job. This podcast is.
And I'm not Bob the Fix-It Man. I don't have a tape measure. I don't carry one around. So like. And I haven't looked at a tape measure in so long.
So the guy commented, and he was like 45 to 50 centimeters. And he put like that crazy looking emoji, like, oh my God. And we both commented. We were like, he meant millimeters. Like, so
I'm like, oops, brain fart. I meant millimeter.
Our producer, Joey, fixed it in the, he put it nice and big on the screen with like asterisks.
He noticed it. We didn't notice it.
Joey caught it. And we commented, and the guy was like, no, I'm just busting. He's like, I'm an aesthetic doctor from Africa or something, right?
South Africa.
Africa. He was like, just pop it in and like wanted to mess with you. Like it was just so funny.
Yeah.
But we love the interaction. Like we love.
It's so fun.
Yeah. Yeah. So make sure you guys comment, leave us questions.
We've met so many people through this podcast, and that's one of the reasons why we wanted to do it. It's like such a great platform to educate each other and see where we all came from too.
And get to meet so many different injectors, and not even injectors. We just had an OBGYN. We had a dentist. Like,
oh my gosh.
It really is fun. We learn like so many different things, and we get to share it with all of you. So
yeah, I love it. Love it. Oh my God. Well, thank you guys for tuning in to another episode of the Fill Me In podcast, where we dive deeper into the world of aesthetics. We talked about pregnancy safe skincare today because of our lovely lady over here.
Thank you.
How many months pregnant are you?
5 months. I'm like 5 months and a week. Yes. Yep.
Can't believe it. And your due date is when for our viewers?
May 31st.
Look at this little ball.
It's very small.
Love it. Aw.
But I have a lot of torso, so I think he's going to hide for a while.
Oh, you're going to be all belly. All belly. Yeah. So this baby's going to be a Gemini, most likely.
Yes.
I love a good Gemini. Oh my gosh.
I'm preparing myself.
Oh my God. Stop. No, they're the best. I love Geminis. I have a bunch that work in my office. They're they're great.
Yeah.
But anyway, thank you guys for tuning in to another episode. Well, we'll see you next time.